Hi everyone, in this video we're going to talk about depression in older adults.
We will discuss what geriatric depression is, what causes it, what symptoms are associated with it, how to cope, and what resources are available. To start, we're going to give you a little bit of background as to what geriatric depression is.
To start off, we asked some fellow students what their thoughts on geriatric depression are. What do you think some common symptoms of geriatric depression are?
I feel like probably anxiety, a constant worry, sadness, lack of hunger and lack of sleep, just always thinking about things and feeling worried and sad about things, just down and not having a lot of energy.
Okay. What do you think geriatric depression is?
I think it would probably have the same kind of causes and symptoms as what you think of with typical depression, just more specific to that age group.
What age group do you think is most likely to commit suicide from depression?
Probably developing teens because they're going through a transition stage and I feel like their bodies are changing, they're going from different schools, different friends, different environments. So yeah, most likely developing teens.
Okay. Why do you think some older adults become depressed?
I think a couple big reasons would be that maybe they're not working anymore, so they have more time on their hands, or they might feel more isolated from the world when they're not going out every day and working, and maybe now that their kids are grown up, that just contributes to them feeling isolated and all by themselves.
The answers to all of these questions will be addressed throughout the video. Geriatric depression is a serious mental and emotional disorder affecting older adults. It is characterized by feelings of sadness and despair. Depression among older adults is not uncommon. In fact, late-life depression affects about 6 million Americans aged 65 and older, but unfortunately, only 10% receive treatment for depression. Although occasional feelings of sadness and gloomy moods are normal, long-lasting depression, however, is not a typical part of aging. Many older adults suffer from a condition known as subsyndromal symptomatic depression, or SSD. This type of depression implies that a person's symptoms do not quite meet the criteria for a diagnosis of major depressive episode. Like depression, symptoms of SSD must have been present for 2 or more weeks and have caused social isolation, withdrawal, or changes in behavior. The National Institute for Mental Health estimates that as many as 5 million elderly people in the U.S. suffer from subsyndromal symptomatic depression. It is believed that SSD symptoms may be a risk factor for developing major depressive disorder in the future. Depressed elderly are also at a high risk for suicide. White men aged 85 and older are more likely to commit suicide than Americans in any other age group, taking their lives at 4 times the rate of the general population. According to the CDC, in 2012, 40,600 Americans took their own lives, and 6,648 of those, or about 16%, were older than 65.
So we've talked about what depression is and how prevalent it is, but what is it that causes depression? The answer is that depression can be caused by a variety of factors. The roots of every case of depression can vary from person to person. Some common causes of depression in the older adult population are medical conditions, medication side effects, and possessing certain risk factors. Medical conditions such as Parkinson's disease, MS, stroke, heart disease, and diabetes have all been linked to depression. In addition to the medical conditions themselves, depression can also be caused by side effects from drugs used to treat certain illnesses. These include, but aren't limited to, blood pressure medications, beta blockers, high cholesterol drugs, painkillers, and arthritis drugs. Depression can also occur when people have certain risk factors. Risk factors are traits a person possesses that put them at a high risk for developing depression. Some risk factors include being socially isolated, having a family history of depression, experiencing stressful life events either presently or in the past, as well as a poor sleep schedule. Medical conditions, side effects for medications, and risk factors are all important areas to consider when looking at what causes depression. However, it's also important to consider that sometimes depression can be overlooked or misdiagnosed. Often people overlook their signs of depression and consider them to be common signs of aging. If you're socially isolated, it may also be hard for people to pick up on your signs of depression. It can be difficult to realize that physical complaints can also be signs of depression, and it's even more challenging to talk about your feelings and ask for help. Furthermore, depression in the older adult population can be misdiagnosed with dementia. Some of the signs and symptoms overlap, and which leads to confusion between the two. Important differences that should be considered are that depression has a rapid mental decline, while dementia is slow. Depression is associated with difficulty concentrating compared to difficulty with short-term memory with dementia. Often those with depression notice and worry about their memory issues, while those with dementia don't seem to notice or worry. Shortly in the video, we're going to discuss some of the symptoms of depression. If you have a medical condition, are experiencing side effects from medications, or possess certain risk factors that were just discussed above, pay close attention to the symptoms and reach out to a doctor or a loved one if you're concerned that you or someone you know might be suffering from depression.
There are two categories of symptoms pertaining to depression, including emotional and physical. Emotional include difficulty concentrating, remembering things, making decisions, fatigue, a feeling of guilt or hopelessness, insomnia or excess sleeping, irritability, restlessness, overeating, loss of appetite, loss of interest in activities you once felt enjoyable, feeling of anxious or you're empty, and thoughts of suicide. And physical symptoms include headache, backache, muscle and joint pain, exhaustion, fatigue, loss of appetite, weight loss, dizziness, and lightheadedness.
We've talked about some of the common symptoms of geriatric depression, and in order to further understand this mental illness, it is important to note that there are a few differences in symptoms between older adults and younger populations, as well as differences between ethnicity and gender. Depression in older adults may present itself somewhat differently than in younger adults. For example, sleep disturbance, fatigue, slowing of psychomotor skills, loss of interest in living, and hopelessness about the future may be more prevalent in late-life depression than in depression in younger or middle-aged adults. Complaints of poor memory and concentration are also common among depressed older adults. Research has shown that symptoms also vary between ethnicities. Some evidence suggests that older African Americans are even less likely to report dysphoria than European Americans and more likely to report thoughts of death and suicide. Moreover, there are differences between male and female older adults. With respect to somatic symptoms, depressed older women report more appetite disturbance than men, whereas older men report more agitation.
There are many ways to prevent depression in older adults. Some include staying engaged, and that includes going out into the world, like try not to stay cooped up in your home all day, go outside to a park, take a trip to the hairdresser, have lunch with a friend. You can volunteer or help others. That will make you feel better about yourself, and you can also expand your social networks. Another way is you can take care of a pet, and a pet can keep you company, such as a dog or a cat. You can learn a new skill or something that you always wanted to do because you have more time now, and it sparks creativity. You can also laugh a lot because laughing boosts the immune system, and it's just a good way to stay happy. Another way is healthy eating habits. Try to eat well and get enough sleep. Eat a lot of green leafy vegetables and fruits. And lastly, you can go to counseling sessions, and that includes religious and peer counseling, and it could ease loneliness and hopelessness and depression. It can help you find a new meaning in life, which is essential to longevity. And therapy will help you work through all your stressful situations in life. You can heal from your losses. You can process difficult information. It can also help you have a positive outlook on life and cope with many things. Support groups will help you cope with depression and illness, and they have been shown to be very beneficial to people improving their mental health.
You could take care of a pet.
And do some basic exercises.
Keep a journal to document your day and savor memories.
And get a good night's rest.
When someone you know and love is clinically depressed, you want to be there for that person. Still, keep in mind that your friend or loved one has a medical condition, so giving support may mean more than just offering a shoulder to cry on. Things you can do to help someone with clinical depression include: realize treatment is key. Talk about it. Stay in contact. Focus on small goals. Remember, patience is key. Another one is to do your research. Find local services, encourage doctor visits, and pay attention. Additionally, some things not to say for a loved one with clinical depression include, it's all in your head, we all go through times like this, look on the bright side, you have so much to live for, why do you want to die, just snap out of it, what's wrong with you, and shouldn't you be better by now? When someone you know is showing symptoms of depression, here are some examples of what and what not to do.
I don't know, I've just been feeling so tired lately. I can't get out of bed and concentrate on anything.
What do you mean? What's wrong with you? Just snap out of it.
I don't know, I've just been feeling really tired lately. I can't focus on anything and I have no energy.
I'm sorry you're feeling this way. Why don't you sit down and tell me what's wrong?
There are many ways to detect depression in an individual, but some are way more recognizable than others. These ways include difficulty sleeping or sleeping more than usual, changes in appetite, withdrawal from social interaction, loss of interest in things that used to be pleasurable to the person, lack of energy, and difficulty concentrating or remembering things, as well as feeling worthless and helpless.
There are many hotlines that you can take advantage of if you do experience feelings of depression or suicidal thoughts. One is the National Suicide Prevention Hotline at 1-800-273-TALK. Another, Depression and Bipolar Support Alliance, DBSA as short, at 800-826-3632. Another is America's Psychiatric Association at 703-907-7300. Another at International Foundation for Research and Education on Depression, and this is at www.ifred.org. And the last one is the National Institute of Mental Health at 301-443-4513 and at www.nimh.nih.gov.
We hope you enjoyed our video and found the information helpful.
If you or anyone you know is showing symptoms of depression, we encourage you to reach out to one of the resources we mentioned.
For your convenience, the services and ways to access or contact them are listed in the description below the video.
Thanks for watching!